Welcome to Diagnosing Dx, the podcast giving diagnostics the platform it deserves. While therapeutics and devices often take centre stage, diagnostics is the engine driving precision medicine. I'm your host, David Philby, and each week we spotlight the innovators, breakthroughs, and real-world challenges shaping the future of DX. In this episode of Diagnosing DX, I'm joined by Sally Ann Bowden and Billy Joe Kerns, founders of P3 Consulting, two veterans helping early-stage diagnostic startups navigate today's brutal funding and regulatory landscape with fractional C-suite support. We dive into why so much innovation never makes it off the shelf, what investors now demand before they'll write a check, and how founders can de-risk their science before it's too late. Welcome, Sally and BJ, to the show this week. Great to have you on. How are you both?
Doing great.
Doing great.
You.
Very good, very good. I'm excited to do the show because this is the first time we've had two guests on at once, which is awesome. And you guys really are at the forefront of everything that's happening in diagnostics at the moment, and probably the biggest challenges and bottlenecks that we're seeing in the industry, which continue to cause some pretty big hurdles for early stage companies to overcome. So before we get into everything that you guys are doing, it would be great to do some introductions to yourself and your backgrounds and careers. Sally, I'll start with you, and then we'll pass the torch to BJ.
Thank you. Thanks for having us today. We're excited to be here. I've spent the last 30 years of my career working in the diagnostic and medical device space, primarily focused on regulatory and operations. Held executive roles at Roche Diagnostics, Ventana Medical Systems, and was a professor of engineering at Purdue University for a while. But I've been consulting basically with startup companies in the same space for the last 17 years, really helping them bring their product to market, whatever their new invention or new IP was. So I've had a lot of opportunity to work with some amazingly smart and wonderful people to bring some great products to market.
Lovely. Thanks, Sally. BJ?
Yeah, so thank you so much for having us. We're really excited to have this conversation. We're obviously seeing a lot of change and movement within the industry. I started my career as a medical technologist. I was at Duke for 13 years and ran multiple labs within the Comprehensive Cancer Center there before transitioning into industry. I've actually also, like Sally, held multiple leadership roles at companies like Ventana Medical Systems, HTG Molecular. Did a little bit of time with Promega, which was exciting because that was really at the boom, if you will, of the DNA and RNA work that was being done in diagnostics as we were transitioning away from traditional proteomics. And then wound up deciding to work with Sally in a business venture that we initiated in December of 22, where we actually work with a lot of startup companies in the areas of diagnostics, life science, and biotech.
Wow. So this is P3. You guys have been now working together for 3 years. Who are P3? What are you guys doing, and where's the sort of work taking you at the moment? Because I think with a lot of consultancies, it often there's a reason to start, but then actually the industry can drag you into needs that are relevant at that time, and it feels like there's critical needs at the moment in the industry. So what are you guys working on at the moment? What does P3 do?
So I really think back in the day, it was easy to have a niche consultancy. So I started very focused on regulatory, and that served me well for a long time. Now what we're seeing is the environment is so different, and we have so many startups that need a full C-suite almost of folks that have the experience to bring this IP to market, because we have scientific founders, we have very academic folks that are founding companies that maybe haven't done this before. And
Mm.
so to be able to provide the knowledge and the scars, because Lord knows we have plenty of them, from where things have failed in the past, and we failed fast and learned from it, that we can bring to the table to help folks, make the most efficient use of their funding dollars. And then I think that's the other big thing, that BJ and I learned, and I'm going to let her talk about this a little bit, is that funding has been such a huge issue for these startups. And, when we were putting this company together, we did voice of customer with a lot of tech transfer offices at medical academic institutions.
Okay.
And it is alarming how much amazing discoveries are sitting on the shelf that
Mm.
will never come to market because there's either no funding or no people, not enough resources to bring them to the light of day. And that is truly sad. And so one of the things that we had to pivot on was, how do we help bring funding to these people and help them do fundraising? And that is really a strength that BJ brings to the table with our clients, is we help them do that. And, I think that's been the biggest shift for us of what we've had to add based on the market. But BJ, you want to talk about that just a little bit?
Yeah, I mean, certainly, it's no secret that, funding for startup companies and startup ventures have gotten, over the last couple of years extremely tight. And in fact, I would say probably last year there was very, very little going on for the startup networks when you look at kind of the amount of money that was being spent versus the number of companies that were actually out there seeking funding. I know that, we hear all the time that, oh, there's funding out there, you just have to know where to go look for it. Well, there really isn't as much going on. I think people are very nervous about our political, geo-eco environment these days, and they are kind of in this wait and see mode. They're protecting and supporting their already existing portfolio companies, and they're investing probably more cautiously than they ever have. And so because of that, we have, as Sally said, we've met with a lot of diagnostic and life science and biotech companies that have amazing technology that could be extremely valuable for patients and for research, that just can't get the funding that they need to get their programs off the ground. So, this shift, as she mentioned, really, I would say, happened almost from the very beginning. When we launched, we saw this beginning to happen.
Mm.
Um, but yes, we definitely see this shift in financing. The nice thing is that we have a very, very vast network. When you've been in the industry long enough, you develop relationships. And as those people mature and have money and sell companies, they have dollars that they want to invest. So we're not just beholden to just looking at the VC and private equity firms. We can also look at people of high net wealth, family offices, lots and lots of different, societies that are out there raising money for very specific niche areas that we can tap into to help our clients get money.
So, is funding right now the number one thing that you're asked to support with?
Yeah, we're absolutely asked to support with our network to try to help them seek funding in
Yeah.
one variety or another. Yeah,
I would say funding and regulatory is still a driver,
definitely.
because that's something that you don't necessarily need full time. So bringing in a consultant to help with that makes sense. And the other area that that has really taken off this year is being an expert witness. So
Right.
doing the research, doing the due diligence, breaking down where product failures happened, that resulted in some sort of harm to a patient, is an area that I've gotten into quite a bit this year.
Oh, wow. That's really interesting. What's caused that move?
I don't know. I can't speak to why that is, but there is a lot of product failures out there that have caused some serious harm, and And so being able to go in and work with, a legal team and support them and help them navigate the regulations and the requirements and what the manufacturer was supposed to do and not supposed to do, and getting all the records and reviewing all that and kind of doing this, deep dive into the facts of the case, has been really interesting for me.
Mm. Um, the we're obviously going to talk about the funding aspect because it's so
Mhm.
prominent. And obviously you guys are at the forefront of that. Um, Sally, you also mentioned finding the people to take this technology, take good science into the market. What do you mean by that in terms of where's the science sitting? Where's the bottleneck and what needs to be done to sort of overcome that?
Yeah, so the science is sitting in these tech transfer offices of these, academic medical institutions. So, you have all this brilliant faculty that they're doing all this amazing research in all kinds of different areas, and they patent it, you know, w- with the university, and it's sitting there untapped. And in those conversations we've had with the heads of these, offices, they they said, we don't have all the funding. There are not enough people out there like BJ and myself that can come in and help them bring stuff to market. There just aren't the resources. And so when we go and talk to a tech transfer office, they really sort of put their runway together, what they think they rank the technology sort of on the most viable, what they think has the best legs and the best opportunity, or maybe has had the most studies or is further along. So they do help kind of figure out, where we are.
Hmm.
But if you think about every tech transfer office in the United States, not even considering global research that's being done, think of all the wonderful inventions that are sitting there that we cannot get to market.
Why is it? Or how does that compare to like 3 years ago? When in my head, the caution in the industry really kicked off in summer 2022. So 3 years ago, almost to the day.
Mhm.
Um, Before that, we obviously had this sort of almost frivolous period for a couple of years. After the initial COVID lockdown in early 2020, the boom after that, serious investment everywhere, reckless investment in many cases as well, and people, lost a lot of cash. But what's different compared to now, or now compared to back then, say 3-4 years ago? Where are those people that would typically be saying, we're going to take this science and create the company and license it and bring it to market? What's happened? Where have they all gone?
Well, you have a number, I think, of dynamics going on that's affecting what we're seeing. And I agree with you. I do think that some of this shift began a couple of years ago. And I don't know if it was so much frivolous spending that was happening. I think, um, let's face it, things are changing at the speed of light these days, right? And so what used to take a couple of weeks or a couple of months to really make an impact on the world that we live in is now making an impact in a day, right? And so when you think about it in those terms, I mean, the internet has certainly, sped up the ability to communicate change and things throughout the all industries, actually, not just ours. And so because of that, I think the ability and the systems haven't been put in place to really be able to monitor what's going on. I'll give you a great example of that. I'm working with a company overseas right now. They've built an excellent device for detecting febrile neutropenia in cancer patients. It's on market overseas. It's
Mm.
going through the FDA right now here and will launch here shortly. That company is doing the exact same thing that US taxpayers paid $25 million to a startup company here in the US, and 7 years and the product still isn't on market. So the question is, who's watching that stuff? Who's especially those kinds of dollars, right? Where it's non-dilutive funding, it's being paid by taxpayers. Who's watching what's going on both domestically and globally to make sure that we're placing our taxpayer dollar bets, if you will, in the right place? And I think it kind of starts there. Right. And then from there, what winds up happening is you have investors that are watching, what NIH, what NCI, what the government agencies are actually funding, what the FDA is putting through and allowing as breakthrough status. They're watching that to see, you know, what what they're going to actually invest in the future, and they're going to be keeping their eye on. So you kind of get this snowball effect that if you're not watching it all the way back upstream, where that research's dollars are actually being distributed into the academic medical centers where all this great stuff is happening, if nobody's really monitoring that well, then what happens is you get this kind of snowball effect. And then when they pull the plug on that funding, right, and everybody's saying, okay, wait a minute, we probably need to back up here and be a little bit more conservative in our approach. I think that that's really kind of what we're seeing right now. Now, will the pendulum swing? I suspect it will, right? The idea is that you always tighten down, maybe in an overreactionary way, and then the
Yeah.
kind of swings a little bit back more towards center. And I believe we're starting to feel that a little bit more now, um, finally. But you know, we can't continue really moving forward, I think, as a country, an innovative country in leadership position, without beginning to start, making some investments in these startups that can bring some really great stuff for the world, not just for the US, but for the world.
Yeah, that level of caution, um, and it's understandable. There's been a lot of things this year on the macro level that nobody really understood how to navigate. With tariffs and stuff like that. It's like nobody had a clue what was going to happen. For some people, still don't, right? And it's still changing on a weekly basis. We're getting still new updates and what's going to happen next. But are you seeing that pendulum start to move back to center now? I mean, we've produced our September report today. There's actually quite a significant amount of deals done in terms of whether it was early stage raising,
Mhm.
or even sort of B and C rounds. But then again, July and August were so slow, the summer months. So is it just the average anyway? It remains to be seen throughout October and November if we've actually, start to see the pendulum swing. But what are you guys seeing?
I think it is. I think it was slower in the summer, but I think that's classic. But if you were already slowed down, right, and you're seeing it slow even more, it really does kind of feel like there's really not much movement. But the reality is that we do have investors that we know that are engaging and that are interested in looking at what these companies have to offer. The companies, I think, have to be, I don't want to say more prepared, but they have to be able to produce things, completed strategies and budgets and things way earlier, like succession planning at seed round, which no one ever had to do before. But investors want to understand at a seed round now, what's going to be your succession plan. So there are things that usually would be more downstream that I think they're wanting more complete thought and pen to paper about before they donate or invest in your company. So I think that that's just part of the caution, right? That's going on in the industry right now.
Are you seeing more movement coming from specific pockets of capital? So, quite famously for a period now, VCs have been um, less interested in new investments. Traditionally, what they've been great at, the early stage stuff, seed, Series A, and instead reserving their capital for um, follow up rounds, existing portfolio companies, series B and C where there's already huge amounts of proof of concept and they're just sort of, extending runways, or versus like private, family offices, angel investors and stuff like that? What seems to be sort of the first movers?
Um, well, I mean, certainly I can't speak for, I wouldn't want to lump all, family office and all VC and private equity into the same bucket, but I would say in general, um, family office is moving a little bit more now than it was. Through the entire time, I've had venture capital and private equity people that would at least entertain a discussion around what a new company is doing to see, if it's something that they want to do. I think, one of the things that I would say, if you had to tell a startup what are the key things that I need to be aware of in the gotchas, it's, nobody's making investments right now in nice to have. Right? People are making investments in must have, right? It's going to actually change the way medicine's practiced, or it's going to change the way, we do something specific, or it's something that's, been needed to be developed that hadn't been up to this point. So must haves are things that investors are looking at. Why? Because people are going to buy that. Even in, a recession period, people are going to buy must haves.
Mm.
So, that's kind of the one thing. The other thing is how are you actually gonna make money and what's your competitive landscape, right? And to Sally's point, in a way, it really all starts with regulatory strategy when you're talking about a diagnostic. So what or a device, right? What is your diagnostic strategy and regulatory strategy going to be? Because that then has a domino effect into every other area, if you will, to the pitch deck, right? So getting and Sally should chime in here for sure, but getting sometimes new CEOs, founders, who are doing their company for the first time to really be able to put pen to paper on what's your intended use statement, right? So that then we can let everything else fall into place, right? You can build reimbursement, go to market assessment, pricing, all those things, right? That you need to have to be able to basically put your business plan together that's then going to entice an investor to invest. And so, I would say there are no shortcuts to this, right? You really have to do your homework and you really have to know what it is you're going to do. It's not just, I kind of have a feeling that this is going to work in this space and my product will do X and solve world peace and world hunger. It just doesn't work that way anymore. Not at all.
Mm.
Product definition is the single most important thing that we have to get done,
Yeah.
and defining how that's going to evolve in time. The elephant doesn't have to be eaten in one meal. So how do we take, what your ultimate goal is for your product or your IP, and how do we stair step to that final intended use in a way that's going to bring some revenue in? Maybe there's already reimbursement codes for a different intended use. Breakthrough is given on intended use. So how do we differentiate from somebody else and potentially go after that? Is this something we can start as a lab developed test in a CLIA lab and start, generating some revenue, building KOL knowledge, getting some more data before we go to FDA? There's all those things to consider, and sometimes getting founders and CEOs to sit down and hash that out is difficult, but it's important.
Yeah. I also think too, to kind of add on to that, I think sometimes there's a belief that they've already gotten there. That
Mm.
that they know they know what that intended use is, but it tends to be so broad, right, and so far reaching that if you were to try to sit down to build the validation study that you needed to be able to submit to the agency for clearance, you'd never be able to do it, right? So it's getting them to kind of, as Sally said, chew the elephant a bite at a time and understand that as great as it is that this particular invention can do multiple things, um, we would actually call that pipeline, innovation pipeline, right? So you have one thing that's extremely well defined, and then you have, several other potential work streams and innovations that can occur in a pipeline that just demonstrate that you can actually, you're not a one trick pony, right? And that you actually can develop a product portfolio that's going to continue to build revenue and enter different areas of that market segment, because it has a different intended use.
So within DX specifically, are you what are the sort of most common challenges then that you're seeing at early stage companies when they're sort of seeking your help? What are those challenges and the sort of gap between where they are versus what investors want right now? Because that landscape has changed. As you said, it's now everything's been pushed upstream. What used to be a requirement at Series A or B is now a requirement at seed, and therefore founders who quite commonly have been thrust into, suddenly running a business maybe straight out of academia, um, have no appreciation for what they're going to go up against. So what are them sort of most common misconceptions that they're coming into the market with and investors are actually now looking for upstream?
Well, I mean, I think, as I said, I think they're looking for. I guess the only way to term it would be they need a complete business plan. When I say complete, I mean complete, right? What's your intended use statement? What's your reimbursement strategy, right? What's your go-to-market strategy? And it's going through these decisions with an eye on two things, right? How do I get to revenue generation? How do I get to revenue break even? And then what's my exit? And so, one of the things that I would say sometimes as a you know young or new founder or CEO, you're trying to build your company, right? You're trying to sell the idea that you have to be able to get the funding to actually do the work to build your company. You got to be thinking all the way down to exit now at the very, very beginning. I'm going to build this and this is how I'm going to do it. And here's going to be my regulatory path and all these other things that I'm going to then get to revenue and then to revenue break even. And my exit is acquisition. And I already know, and I'm beginning dialogue all the way back here, right, with my strategic partners, so that when the time comes for exit or any time, if you will, along that process, there's always the ability to exit right to a strategic partner.
But I think it's all about risk, right? So we're
Sure.
seeing investors want more risk managed sooner.
Yes.
Where they used to understand some of these things were going to happen later. Now they want all of that considered up front. And that so when BJ's talking about this complete business plan, it's de-risking and identifying what all those things are and having an answer for them from the very beginning. Which we didn't always have to do that.
Yeah, but in a way, that's not a bad thing, right? In terms of
No.
the due diligence that's now being requested up front, probably puts the industry in a much better position should capitals well you the problem is, will people remember this, in 1 or 2 years time? If capital is flowing a bit faster, does the scrutiny start to fall? Does the focus on minimizing these risks start to be forgotten again? Is everything
I don't think
cyclical?
so.
But that would be a good thing then, right? You hope that actually we're building more robust companies that actually have much more chance of making it and making the intended impact on healthcare systems or a set of patients.
That is true, but some of these risk mitigations require funding. So it's a
Right.
chicken and the egg kind of a
Yes.
discussion where, we need some money to get the data, to do some of the testing, to have the FDA conversations, not that those cost money, but just the data that you have to bring to them to start,
Yeah.
having those. So you can't de-risk everything on a shoestring budget. You can have a plan for what that looks like and how use of proceeds are going to be used to de-risk. But at some point, it comes really down to, I think, the plan, the credibility of the team, the experience that the team has, having the right players on your team, so that there's some comfort, and that can be a de-risk kind of strategy as well, is having that org chart with fractional people that are going to be part of that, to build investor confidence.
So that
Yeah, I also think it's a you're seeking for investment. It can't be a shotgun approach. It has to be kind of a matched approach, if you know what I mean. What I mean, and what I do mean by that is that you do have some people who are making investments that want you to have a full staff on board, right? There are others that say, we're okay with fractional leadership in certain areas, and that's actually demonstrating a good use or a wise use of the monies that you have and that we're getting ready to give you. So part of it is you got to really know who it is you're asking to invest in your company and what their preferences are and their historical track record of who they have been investing with and what they value. And I think that's one of the things that we kind of bring to the table with our network is because we're not, a broker just going out, and talking to 650 people about a particular company. We're going to the 10 or 20 that line up and that share a core value and thesis, if you will, between the investor and the company. And it just seems to work better that way, as opposed to trying to kind of go after everyone that has, any money and hoping that things line up because they won't. I do think what does still very much hold and resonate is look, investors want you to have a 5-year business plan written out. And you can do that as a seed, but the reality is you haven't built the product yet. You don't know what you're going to bump into. You've tried to de-risk it from the standpoint of thinking about the things that could go wrong so that you're managing that risk, as Sally was talking about on the product development side. But, at the end of the day, sometimes the answer is, look, we have to get really comfortable as a startup knowing that we're going to make suboptimal decisions sometimes, right? And that's going to happen because of money and people. But we always reserve the right to get smarter. And we will. And as we get smarter, you'll get smarter with us. And we'll grow, into a company that will actually be very meaningful and contribute. And also, quite frankly, make money. Because at the end of the day, we can't lose sight of the fact that people are making an investment. Unless it's a donation in a nonprofit, they're making an investment to make money. So they want to understand what's your risk profile, what are the chances that you can execute against what you say, which is why who's in your C-suite matters, because you've got people who've been there and done it before, that de-risks that portion of the ask. And so all of these things kind of culminate into what I still go back to say is you just need a really well written, thought through, de-risk business plan to be able to put in front of an investor and they go, yeah, I think they got this together. I think they can pull this off. Because at the end of the day, that's what they want to know. Can you pull it off?
Mm. So to put together, a robust business plan like that, you're going to need support and help, whether that's fractionally or full time. I mean, that's a full on, business undertaking that requires people with different perspectives, whether it's commercial, regulatory, you
Yes.
know, reimbursement and everything in between. How much does the leadership and culture that you put in place in a company at that stage actually matter to investors and the success of a company? Are they measuring that? Are they looking at the who, not just that you've got someone in place for that position?
Yeah, I mean, they definitely are looking at the who. They wanna know, have you been there and done that? Right? I mean,
Yeah, for
they
sure.
to even get their attention, quite frankly, you need to know, here's the problem statement, here's how I'm solving it, here's what I'm competing with in the marketplace and why I think my solution is better, and here's the handful of people that are going to be able to get that done, and their backgrounds to demonstrate that they've gotten it done before.
Yeah,
Mm.
and I think it's important to not just, who are your day-to-day teammates that are on the org chart, but who are your KOLs? Who's advising you scientifically?
Yes.
Who's on your board? I have seen companies fail with great technology because they had a horrible board of directors, right? And they didn't know how to manage and direct a young organization. So I think the board is really important as well. Who do you pick to be on that? And just that whole process is really, really valuable.
I find that interesting, and I completely agree. And obviously, I'm from the talent side, but one of the one of the interesting things I always come into contact with early stage diagnostics companies is how hell bent they are on bringing people in that they already know. And I understand that for the element of trust and that you know them, you've worked with them, but it doesn't mean they're the right person to do what you're about to do. It's the easy option in many ways. You've started a company, you now need someone to the right of you who is the commercial person and you're the scientific person, whatever, right? And you go, I know a commercial person, I've worked with them before. So that sort of, it's nice to go on the journey together. But to go back to what you guys said about of having been there, done that, that's sometimes an afterthought in that they're not going, I need someone who brings the experience that will ensure we know the direction we're facing, how we're going to get there, and can overcome the hurdles along the way because I know they've done it. Instead, they go, well, these are the people I know, who's the best one out of them. I don't even have any appreciation for what's in the industry from companies that have been there, done that. I don't know those people. I don't know who was at them companies at the time, but they're just not in my network. And I think it's a huge gap in diagnostics that has been caused by this. And rightly so, a few years back when everybody started sort of tightening the purse strings, it's like, okay, we can't afford to find the best, so just find the easiest. But it's causing problems. You're seeing these companies of people who worked together before, have a nice little team, and they like each other, failing. It's like, well, at no point did you try and hire the person that was going to get you there. You just put together a team of people you liked.
Yeah, we
I
see
see it
that.
all the time.
Yeah,
Yeah,
we
we
do.
see it as well.
Yeah, we see it. We would call that groupthink. It's easier, when you have, I'm going to say this very gingerly, but when you have someone who is not a strong leader, it is
Okay, yep,
easier to hire people where there is groupthink, right? The risk, as you say, in groupthink is that you don't get the best. You
yep,
don't get all the options.
yep,
Now I understand that, when you're just starting, you might want to have, one person on your team that's kind of your go-to person that you want that group think with because it expands your bandwidth, but you definitely don't want a whole team of those.
mm,
Right? You definitely want to go out and try to find the best for what it is you're doing, and you want to stay away from groupthink as much as possible.
And I would think that, and again, I think this goes back to your how strong is your board, you know,
mhm,
and usually your lead investor, somebody usually has a spot on your board, right, with your company. if they're seeing that everyone we're hiring is somebody you worked with before, why are they not speaking up and demanding something different, right? Because that is not the sign of a strong leader to do that.
Mm,
Yeah. No, we're not advocating confrontation, right? That's not at
no.
all what we're saying, but strong leaders understand that they need people smarter than them on their team
Yeah.
in certain areas, right? We worked with with a great CEO, TJ Johnson. He used to always say, I'm going to surround myself with really smart people, right? Because that's how we're going to get things done. He didn't particularly care for that group think we're gonna let you make all the L1 decisions, and move forward. He was more about, here's the vision, here's where we're going. You all, have your expertise in your given areas. So now
Yeah.
let's work together to get this done and get this knocked out. But that takes somebody with what I would say strong intestinal fortitude, right? You have to really know that, hey, I have my role and I'm hiring the best of the best people that are smarter than I am to do other jobs, and that's okay because we're going to
Mm.
succeed. At the end of the day, that's all that matters, right? Is succeeding and succeeding the right way.
What about academic founders specifically? What are the challenges that they typically face, or because of who they are, specifically, you know, struggle to overcome or struggle to sort of be prepared for when they're put into these positions?
Well, I think the first thing that I see and that we've experienced is that product definition. Academic founders tend to want to keep tinkering with their product design. Um, and at some point, I think the concept of good enough to go to market, they struggle with. We have to lock down a product. We have to have a final product design.
Hmm.
And it may not be perfect, and there may be something down the road, an evolution to that, that makes it better. But we have to be done researching, right? And get it to market. And I think that is something that academics really struggle with, because they want it perfect. They want their baby to be the most beautiful thing in the world. And sometimes it's okay that it has a couple blemishes on it. It's good enough to get it out there and start helping people, first of all, and generating some revenue.
Yeah, the idea of iteration, in a product is
Mhm.
absolutely key in new companies and startups.
Yeah.
Yeah, that makes complete sense. Um, this has been really fascinating, guys. And what else can you sort of say about the outlook of the diagnostics market? And are you optimistic for what we see in the next sort of 6 to 12 months, or how do you see things progressing from here?
Yeah, I mean, I think I am optimistic. I mean, I think purse strings are, beginning to open up. I think a lot of people have done a lot of really hard work to get their business plans, in a position that an investor feels comfortable with and comfortable in moving forward with. And, I think that that hard work's going to pay off, quite frankly.
Yeah. And I think that, one of the things, and this is a post COVID thing, anybody that is taking product through FDA,
Yeah.
um, I think I try and counsel folks to keep their eyes wide open through this process because we have a lot of new FDA people. We have a lot of folks that have been put in leadership positions probably earlier in their career than we used to see.
Mm.
Just because there was such a mass exodus during and towards the end of COVID of a lot of the, seasoned um, senior people, you know. And so it's a coaching opportunity as a consultant to be able to go in and work with some of these younger teams and also be able, to help FDA kind of through their own process because there's so much change going on there. So I think that the sooner the conversations start with FDA, the sooner we start introducing products to them and helping them understand what we're trying to do and building that relationship, the better the outcome is going to be on the back end. And to pick your regulatory support wisely. Somebody that is leading regulatory by reading a book or by reading the regulations that doesn't have those relationships with the actual agency is going to be really difficult to get through. It's a tough time for them. And there's got to be some patience and relationship building.
Yeah.
Mhm.
Thank you for that, guys. It's been really insightful. You guys are at the forefront of everything that's happening in diagnostics right now, and your deep dive into the challenges that people are seeing, but also the optimism in terms of the strength of business plans being better and bridging the gap between where companies are, what investors want earlier on, upstream, purse strings starting to show more favorable conditions is super interesting and bodes well. So maybe we have to get you back on in 6 to 12 months and you come on and see if it's all come true and we're
You
in a
say,
good
"Oh,
space.
no, turn the other way."
But no, thank you so
Yeah.
much for coming on, guys, and spending time to share your insights. It's absolutely fascinating.
Thank you.